Hello again. My disclosure. I work in Ghent in the hip and knee unit, and I have two colleagues here, Pieter van Sint-Jan and Joost Lagast, and there's one fourth in Ghent because someone has to keep the business up. What is important is we work with two data engineers, and since a couple of years we've been focusing on collecting data on our patients to do techniques, choices that are relevant and linked to our data we collect. It has been said previously that 1 in 5 might not be satisfied because of some reasons. When you look at literature, pain at rest preoperatively is a determinant, also postoperative complication. But maybe the most important is expectations that are not met. It means you've made a bad indication or you badly communicated with your patient. Patients' expectations have risen over years. When my father started doing knee replacement end of the 70s, the patient and the family was happy when the pain was gone. Nowadays, the patients, they want more. They want to go skiing like this patient. Everybody wants to remain active. But how to make the proper decision? What is the best treatment for my patients? Should be conservative or do we need to do surgery? What's the best timing for surgery? What's the approach we should use? Which implant? Do we need to use innovative techniques? Which hospital to choose? Which surgeon to choose? It's not you're going to solve it with oil, you're going to solve it with data. We in our department, we're using a move-up system that I co-developed some years ago. We want to collect objective and subjective data on our patients. So the objective data are collected with a wearable device. The subjective data are collected through an application that is available in the App Store and the Android Store. We collect daily feedback of the patient preoperatively and postoperatively, and patient gets exercises in a personalized way. There's also a channel where the patient can chat with the people following up the patient. There is, for the healthcare provider, where it's a physiotherapist or the nurse or the surgeon, there's a dashboard where you can follow on your patients on a daily basis and interact with the patient based on the data you see. It is in Belgium the first digital therapeutic solution that got the CE medical device with MDR 2A classification and which is reimbursed fully for all hospitals since the 1st of October of this year, so very recently. We've been treated over 3,000 patients so far in some hospitals and some healthcare providers, and we have quite some good patient satisfaction. So it's monitoring and managing the patient, and you get increased health insights in the full trajectory. I give you an example of a patient, how we do it in our daily practice. So for example, that patient was operated 10th of August, so when I made the presentation, it's 39 days after the surgery, so somewhere in September I've made the presentation. I was a surgeon in our hospital. When the patient comes to see us, we already know quite a lot of that patient. He has to do kind of check-in before he comes to our outpatient clinic, where he sends his data, where he reports himself, and the physical assistant goes through this report with the patient at the time we enter the clinic with the patient to do a clinical exam. We have already an overview how that patient is behaving, why he's there, and what was his previous treatment. Comorbidities is checked, what type of painkillers is he taking, and we see his treatments preoperative, pre-consultation. We also have a view on their possibly preoperative prompts. Postoperatively, so I skip a phase, postoperatively, there is a physiotherapist and a nurse following on this patient through the dashboard, so it's fully remotely. The patient fills out questionnaires on a daily basis and wears the wearable that doesn't need to be charged because it's a battery that lasts for 6 months. And the patient is also able to communicate with the physiotherapist in an asynchronous way. Here you see an example of the follow-up of the patient. The red line is the suggested activity level for the patient. It's in a personalized way. And the patient, they do comply with the suggestions that were made. They see that's at day 39 for the patient. They have a couple of exercises they can do, and they see the intensity and the frequency they should do that exercise. If it's too complicated, too difficult, there can be an interaction with the physical therapist in an asynchronous way. We've been collected our data in our hip knee unit since 2016 on a very structured way. You see a standard reporting that we as a healthcare provider get. This is just a standard report in a PDF file, or you can see it live in your dashboard. We collect PROMs, PBOMs, so more activity-related measures, and we collect also clinical milestones, PROMs, etc. Since the end of last year, we also have advanced reporting. That's a patient that was really compliant, so his suggested activity was between the green and the red line, and that patient was extraordinary. He just did it like we told him he should do. And you could say, well, he removed this. Well, that's what we thought. He removed just his wearable tracker at the end of the day when he reached his steps. No. This advanced reporting shows the darker you see the color, the more activity, so that patient was able to balance well his activity throughout the day, so he reached his number of steps or his activity level by the end of the day. So that gives you more insights on how our patients behave. We also have data on 6-minute walking test. We don't ask our patient to walk 6 minutes. No, it's recorded through advanced analytics by just wearing the wearable. Also the longest walking bout. Before the line, you see preoperative situation. The more you go to the right is a postoperative. That's at day 31. So advanced engagement tools are able to see differences that for a long time were not visible to us, and it provides us to share the accountability between the healthcare provider and the patient himself or herself. But how to use all these data in just a clinical consultation that lasts maybe 5 or 10 minutes? Maybe in US it lasts a bit longer, but in Europe it lasts maximum 10 minutes. We want to have a view on knee-related questionnaires, PROMs, comorbidities, past medical history, psychometric tools, socioeconomic factors, functional data, PBOMs, and so on. We developed almost 2 years ago an index. We called it the MoveUp Index, which aggregates all the data you've seen, integrates them all, and we have one score, a score between 0 and 100, and the absolute value for the hip and the knee is different. The importance is not the absolute value, but it's a percentage of gain our patients are able to make postoperatively. So if the score can be doubled, patient satisfaction can be anticipated. How do we implement it in our department? We have the light version, so every patient that comes to see us for the first time gets a questionnaire besides the past medical history and so on, gets additional questionnaires. It's PROM-based, it's a quick check for us and allow us to make a triage. It's the complementary to anamnesis, clinical exam, and X-ray. We also added this piece, which is the data piece. For the patients that might get some treatment, whether it's conservative through injections or surgery, we ask them to complete a full index, which allows us to predict their situation post-treatment, whether it's surgery or conservative with injections. So it gives us a decision tool, so to operate yes and no. It is a follow-up tool, so when I do clinics, I just looked at one number when the patient comes into my rooms, and based on that number, I know where the patient is in his rehabilitation phase, and it's also a data tool to evaluate techniques and implants. So by using that and by applying this, we are able to close the loop, so we are able to compare our outcomes to our decision-making pre-surgery. With the advancement now of the robots, we are able to collect and to integrate all the data in one system, which might help us in the future to make the correct decision and to make the correct surgery. I give you some examples. Don't look at the numbers for this patient. It's 2 years postoperatively. That's the indication, bilateral knee. That's the evolution of the activity levels and the clinical milestones and the evolution of the PROMs and where we can compare them through the full MoveUp population. I want you to look at the PROMs for this patient, Overschelde knee score 30 preoperatively, and the quality of life of the KOOS of 31. Forgotten joint score preoperative is not so relevant. When we look to the, I go back one. Yeah, when we look to the MoveUp index preoperatively, he has a score of 46. At 6 weeks, it was 68, then 69. So you see between 6 weeks and 3 months, it's not evolving a lot, and that's what we see very often in our patients. That's a standard patient for us. Then there's again an increase at 6 months, but there's still an increase up to 1 year and 2 years. And when we look to the PROMs at 2 years, you see a forgotten joint score of 96, quality of life 100, and an Oxford knee score, which is the maximum value. So that patient is a satisfied patient with a pre-op move-up index of 46. So 46 can be doubled. That's a different patient, different starting point. I will skip all these. I go to the last slide for that patient. Remember the Oxford knee score, the previous patients was around 30 as well. The quality of life was 30, and the previous patient here is 25. When we look at the pre-op move-up index, it's 54, and that patient at 6 weeks is even a bit worse than he was preoperatively, and it was the same at 3 months. So that patient takes longer to rehabilitate. His perception of the surgery is different, and you see that the patient in the end is not able to double his pre-op index. And that influences his feeling, his satisfaction level, and so on. When you look to the forgotten joint score, it's 48. It's not that it's too bad, but it's different than the previous patient. Then a third example is a patient of mine operated before we all used the data in a very efficient way in our practice. So it's in 2018 that patient was operated, indication, evolution of activity, and clinical milestones. You see that a patient preoperative, if we have been looking very in detail to that patient, we would not have operated on that patient. But it's not easy in your daily practice to make the correct decision in 10 minutes' time. When we look to the data here, the pre-op index is 63. We will never operate on that patient, or at least we would tell the patient what to expect after surgery. You see that at 6 weeks, 3 months, there is some index that is acceptable. 48 to 49 at 3 months is acceptable, but again, the absolute value is not that important. But at 1 year, it's 31. That patient is dissatisfied. You see the forgotten joint score is 8 at 1 year. So it allows us, by doing that, to decrease our readmission rates. And what is important here, complication rates, that's the complications mentioned by the patient. And when you look in detail to what the patients see themselves as complications, they see, for example, ecchymosis, so a staining of the skin is for them a complication. That's how they report it. So you need to be very careful when interpreting the data. What are the added value for the patient? It prepares the patient, was said previously, post-operative, the patient is monitored, he gets a personalized treatment, and he can do it in his own place. For the surgeon, you get insights into data, and you're able to make the correct decision. The NPS scores for these patients is 74, which when you compare to Amazon, Netflix, and Apple, it's quite good. So my take-home message, engagement tools are an enabler for better and cheaper healthcare. They give us new insights. They deliver us tons of useful data, which will become more and more important in the future. I use the full move-up index, as do my colleagues. Shared decision making is made easier, I think. It increased outpatient efficiency. But one remark, listen to the patient. Besides all the data you collect, I think remains very, very important and key in our practice. Thank you.